I'm going to talk to you about all the circumstances that you've heard and read about in a patellar tendon rupture surgery. The accident happened on February the 2nd, Super Bowl Sunday. I was playing basketball. I did not have any pain or anything like tendonitis or any, it was just like a regular day of exercising. I was playing basketball. I was getting ready to make a move to the basketball goal. Nobody hit me. I didn't trip and fall. All of a sudden, as I was going to make a move, it felt like somebody took a baseball bat and hit me in the knee. So basically what happened was the patellar tendon on the bottom of the patella ruptured, came loose, and my quad ligament pulled that patella all the way up into my quad. It was sitting up in here. There was a lot of swelling. I couldn't tell that that was my patella because my knee and this whole area was just one big, it was just really bad swollen. So anyway, what I'm going to do is I'm going to be totally honest. You see a lot of videos, you see where people are doing exercises at 1 month, at 2 weeks after surgery. I'm going to be totally honest with you. I've been very protective and I'm doing exactly what the doctor told me. So as I tell you this, I'm going to tell you the absolute truth, and I want you to also listen to your doctor so in case there's something different he tells you. Basically, this is the beginning of the 7th week after the surgery, post-surgery. I went to my first rehab session today. Last week I went to my appointment with my surgeon, and he told me that he was going to go ahead and move my brace to 30 degrees, which he did. Told me to start putting pressure on it, putting my weight on it with crutches and the brace on. I've done that here and there, and today I went to my first session. He kind of worried me a little bit because I had it at that 30 degrees, but yet he's pulling on it and bending it into what he ended up measuring being 60 degrees, which was pretty awesome. It was a little bit scary because I understood that a re-rupture can happen during rehab, but in this situation it felt tight, it didn't really hurt, and I got to where it was so tight I couldn't go anymore without really worrying about re-rupturing. So he pulled it down to the 60 degree, measured it, made sure it was 60 degree, and then we quit that. We went into some exercises on the bed where my leg was straight. I had to lift my leg up, just make sure that I had some strength enough to lift my leg. We did that. We put on these electrodes, I forgot what they call, which help the muscle contract, which when I go to contract my muscle, it assists that motion. We did that today. Tonight, to enhance the healing process, because of what I've read about, tendons don't heal as quick as muscles because they do not get the blood flow. That's why they're white, real white, is because they don't have the blood flow. That's what I understand. So they say hot water. So tonight I filled up the bathtub with hot water, and I got in it and I did put my legs straight in there, locked my knees down in the hot water, and then I lifted them up out of the water to where I could feel it really tight, and I held it for a few seconds, went back down underwater, let the hot water get in. So I'm doing that to also encourage the healing process, because my next rehab session is Friday. So I just want to let you know that as far as walking, I did walk on it. I walked about 20 yards, 25 yards with the crutches up in my hand, needing them close by, of course, and I did pretty good. I hopped, which meant I only had full pressure on it for just a split second. So anyway, so what I'm doing here, sitting in the chair, and what I have been doing for the last 2-3 weeks, is I've been doing isometric exercise where I've just been tightening the thigh, the quad, just working that muscle because it hasn't been worked at all. So anyway, like I said, we're at the beginning of the 7th week. As I get a couple more rehab sessions in, I will let you know how things went. But just to remind you, at the beginning, if you're just now starting your recovery from the surgery, you will have hard nights, bad nights sleeping. You might get some twitching and stuff during the night, which causes those muscles to flex and the sharp pains through that knee, which I did get a lot. Every night I was twitching that leg. I wasn't sleeping good at all, sleeping in the recliner. I tried to sleep in the bed, but I can't sleep in one position very long, so I'm always having to turn, so I ended up trying it, but I ended up back in the recliner. So anyway, just to let you know, that is normal. I am getting aching all through the night. So just to let you know, if you're at the 4, 5, 6 weeks, 7 week, and you're still getting aching after exercise, or even not exercising, still needing hydrocodone or whatever your pain medicine is, that's normal. I read about where a guy was at the 4-month mark, which is what, 16 weeks, and he was still aching, and he almost had full motion in his knee. So it is still normal to have that aching, so don't be worried about that. And sometimes I get some sharp needle pains in the top of my kneecap, on top of my patellar. So that just gives you an idea. That's some of the stuff that I ask people that have had it, just to get a feel if I'm on target for my recovery, see if I'm having the same repercussions from the surgery. So anyway, good luck with yours, and I just wanted to, I will get back to you in about the 8th or 9th week and let you know how things are going with my recovery. Thank you.